the pivot away from mRNA vaccines, that is what the rest of the world has done. And I would say, big picture, if we have another a horrible pandemic in this way, the mRNA, I think, one of the things I hope we learn is that's good for the initial phase, but then you need to pivot to other vaccine technologies.
Hello, welcome again to another episode of the Let People Prosper show. My name is Dr. Vance Ginn. I hope you're having a prosperous day. Well, today I'm delighted to bring on a guest who has done a lot of work on vaccines and healthcare and just a lot more. And it's none other than Dr. Monique Yohanan. Monique, welcome to the Let People Prosper show.
Thank you so much for having me, Vance.
Well, it's really a pleasure to have you on. I've been looking forward to this, and you have a great paper coming out that I'm going to talk about in a minute. But before we get going too far, let me go ahead and read your bio for the audience. So today's guest is Dr. Monique Yohanan, a physician and policy leader who spent more than 20 years at the crossroads of medicine, technology, and public policy. She's the chief medical officer at Adia Health, building AI tools to improve patient care, and a senior fellow at the Independent Women's Forum, which does a great job. I've had some other guests from there, just a great group overall. And she recently released a powerful new paper titled Rethinking Vaccine Policy, A Case for Humility, Precision, and Parental Partnership. She's trained at Dartmouth, Brown, Harvard, and Stanford, has taught at UCSF and Stanford, and is a nationally recognized voice on evidence-based medicine. Whether it's tackling the opioid crisis, mental health, or now how we rethink vaccine policy, I'm excited to bring her to the Let People Prosper show. And so with all that great stuff going on, Monique, let me go ahead and ask you the first question I do all the guests. Why do you do what you do every day?
Well, again, thank you, Vance, so much for having me today. You know, when I think about this opportunity, I think there's so many things that brought me to this specific work. As you mentioned, I've spent about 20 years writing evidence-based medicine guidelines, and that's really where I built my career. And I wrote on a lot of different topics. I wrote for adults, wrote for kids, wrote across topic areas. And, you know, one of the set of guidelines that I wrote in 2020 were the COVID guidelines, and they were used nationally. And really at that time, I felt like there was a big disconnect between what I saw in the literature and what I heard public health leadership saying. And with that, it really started a deep dive that began in 2020, but I didn't think that there was a window of opportunity for me to say anything that wasn't party line. So I kept doing my research, kept thinking about it, kept writing about it, knowing that, you know, there would be an opportunity at some point. And with the current administration, I felt with President Trump, with Secretary Kennedy, that there was at least a willingness to revisit some of these topics. So that's really what brought me here today. And I would add to that my day job, which in my day job, as you mentioned, I'm the chief medical officer for a health technology company. And I do think that in addition to a lot of what I focused on in my paper, that this is such a specific moment in time that we have these guidelines that were created in an era of paper charts and rotary phones. And now we have AI tools. We have the ability to do precision medicine, but to do it at scale. So I thought this combination of my experience, an administration willing to listen, and a technology that just didn't exist even a few years ago, all of that is what brought me here today.
Yeah, I love it. I love it. And, you know, you built a career across medicine, academia, health tech, and policy, just all these into one. Is there anything from a personal level that drove you into getting into the center of these big policy ideas? I mean, you brought that up with COVID and everything, but it seems like maybe this is something that sparked your interest well before that, though, too, right?
It did. And, you know, whether it's certainly COVID, I'm talking about vaccines. There's a bit of controversy. Before that, I was writing on mental health parity. And before that, I was writing on opioids. So I do find that many of our debates get so polarized. And so when there's an area of controversy, when people are talking about it, that's my natural curiosity, is that I'm going to want to dive deep into it and take what I know about how to read and review the literature to see, you know, in the midst of the fighting, the back and forth, there is some bit of truth that I think we can find common ground on.
Yeah. Great points there. And I think we need more of that right now. I mean, as we're recording this, we just got into a federal government shutdown where they can't come up with how much they want to spend on the budget, whether it's a clean CR or whatever. And, as an economist, and, I want to dig into some of these things, but I'd love to hear your thoughts more on that COVID situation. During that time, from June 2019 to May of 2020, I was at the White House. I was the chief economist for the Office of Management and Budget. And I was in a situation room multiple times talking about more along the lines of what happens if there's shutdowns, what's going to happen to the economy, and providing information to Larry Kudlow and others. I was really concerned about it from a shutdown angle of how that was going to sideline the entrepreneurs in the private sector that would unleash the economy and get us back much faster, along with the vaccines. Now, there's Operation Warp Speed and everything else that took place, and we've seen what happened. But I would love to get your insights about what you were thinking during that time of the vaccine and COVID and all of that from your research, what you were thinking.
Sure. I think that I come at this perspective from three different perspectives, really. And one certainly is as a physician and writing guidelines. The other is that I'm trained in public health, but also as a mom. So I would say my immediate reaction to this is, I saw what it did to my son, and the kids I knew who were taken out of a school setting, and how devastating that was. I'm a geriatrician by training, and I couldn't help but think that even though I wasn't in practice, think about somebody who was older, who had dementia and couldn't see a face, and just how devastating that would be. When I look back at that time specifically, I do think that I'm stunned, and actually in a good way, like what was achieved with Operation Warp Speed. I mean, that kind of coming together, that to be able to get a vaccine to market that quickly, I think was an extraordinary thing. And I do actually think when I look at the evidence against the ancestral COVID variants, against the Delta variant, that the original mRNA vaccine that came out of Warp Speed did pretty well, especially against people who had multiple comorbidities, who had chronic conditions, who were older. But really, when we got to 2022, I kind of think the evidence fell off a cliff. For a lot of different reasons. So I think it's as with many people, it's complicated. I do think that we are still dealing with a lot of the impacts of that time. And I would say in particular, one piece, and the prolonged school closures in particular, continues, I think, to really get at an issue we are still dealing with. And I frankly don't think public health leadership has quite understood yet. The number of people who lost a trust in the public school system, who decided to keep their kids out of the school system, from a practical standpoint, the backbone of how we have done vaccination in this country really was about school mandates. We don't have enough kids in public schools anymore for the math to even work for them. So, there were the things at the time, but I think there are the consequences that continue to reverberate, especially, I think, for vaccines.
Yeah, great point. If we could, Monique, I'd like to maybe take a step back as I'm thinking through, like, listeners and myself too. Where did vaccines really come from, and like why have they become, in America in particular, and some of your research about this is that we're giving it to them much younger, many more than some other countries. And I'd love to hear your kind of thoughts on where vaccines got started and kind of where we're at now.
Sure. I do come at from my perspective of the vaccines is that they really are an important and overall a good thing. I think that the way we apply them is too broad now, but I do want to not lose sight of that. And one of the things to me that is most important about vaccines, that I think sometimes gets lost in the shuffle with all of this, vaccines at their core do something that is incredibly unique. And when you look at other things that can decrease diseases, like sanitation, for example, they can decrease the amount of diseases. What a good vaccine can do, though, is it can eradicate a disease. So, for example, if you look at a disease like diphtheria, in the 1900s, in the Lower East Side, you had about 2/3 of the population of the Lower East of New York living on the Lower East Side. Up to 1 in 2 kids on the Lower East Side would die from diphtheria. when the outbreaks were awful.
Wow.
And we had great housing reforms. If I'm going to say what actually saved the most lives with diphtheria, it was housing reform.
Wow.
And then it was actually going to private homes.
And just real quick, was that because they didn't live so close to each other?
Exactly. So the Tenement Reform Act that happened in the early 1900s meant that you couldn't have as many people living in apartments, that you had to have adequate ventilation, that you had to actually have a courtyard when you built a new apartment building so that people could get fresh air. Literally just getting fresh air was enough so you have this huge tens of thousands of deaths were saved at that time, and amazing progress. And you see this, and yet still 1,000 kids a year were dying until the vaccine levels reached what we call a herd immunity threshold. And herd immunity just basically means enough people are vaccinated that the disease doesn't travel in nature. People can bring it in through immigration or things like that, but it no longer exists and circulates in the community. Vaccines can eradicate a disease. Sanitation can't. Housing reform, all these other good things can't. So vaccines really are important. And I think about a disease like diphtheria. I think about measles. I think about pertussis. Diseases that, when you think about them, the way that they actually work are when we have population density. Those are diseases that kill off a lot of little kids. That's their history. Without vaccines, when we talk about the history of it, I think we lose sight of pre-1963, for example, with measles. We had a few million kids every year who got measles. We had tens of thousands who were hospitalized, and every year hundreds of kids died. And we can't go back to that. This would be a travesty if we did. But we had this situation where for a long time, we looked at these kind of diseases like diphtheria, like measles, like pertussis, and those were the things we vaccinated against. Then in 1986, so about 40 years ago, we decided to change the game. So for reasons that were there were some mumps cases and some big lawsuits. The manufacturers were going to go out of business. So Congress passed this law and they said, well, you can't sue the manufacturers anymore. And
like an immunity, they have immunity?
Exactly. They have blanket immunity. There's some rules that the federal government sometimes, for catastrophic harm, will pay for vaccine injury. It's pretty uncommon that they will pay. I mean, basically, when you hear about a payment for a vaccine, that means the child either died or was permanently disabled. We don't really allow for any kind of vaccine injury claims, and the manufacturers are protected. But what that meant, think about it, we have about 3.5 million kids born every year. You can't get sued, so why not add a vaccine every year? And not just that you have blanket immunity, but you have this generation of doctors from the 1980s who, in an era of HIV/AIDS and hepatitis B and all, they decided, and I say this having done a master's in public health. When you do your master's in public health at a place like the place I went, they will say every issue of public health is first and foremost an issue of social justice. So I would say it's not just that you couldn't get sued in the 1980s, but then they decided from public health leadership, well, what if we start using vaccines to promote social justice? What if we look at underserved populations that are struggling in so many ways? We can't fix the homelessness issues that people are having, but maybe we can protect them against hepatitis if we vaccinate babies. Maybe we can do something to protect kids whose parents are not so great about getting them to the emergency department when they're dehydrated. You can understand the instinct that people have with this, but it's a fundamental change it starts this shift from diseases that are really casually communicable, really easy to get, you can't avoid, and kind of everybody needs to get vaccinated against, to using vaccination for something very different. So we went from basically 5 or 6 vaccines in the mid-'80s. Now we've got 17 by the time somebody turns 18. So, and in the United States, we handle them differently. So we give up to double the number that many of the European countries do. because we give more of them, we end up giving more aluminum to kids. Because we start earlier, then there's some issues with starting too early. We give more shots, and we really take a position. There are a couple other countries in the world that link getting a vaccine to school, but we are outliers in the world in forcing kids to get vaccinated in order to go to school for most of the vaccines.
Wow. And on, on these different diseases that we're getting vaccinated for, and kids are, and they're getting fewer vaccines, like in Europe, do you notice any differences on how many people are getting these diseases in the U.S. versus Europe?
Yeah, one of the countries that I think is so interesting to look at is Denmark, and they don't have mandates in their schedule. But as an example, look at a combination vaccine like diphtheria, tetanus, pertussis. So common vaccine all around the world, kind of same vaccine. We give several shots, and they only give a few. And we started at 2 months, 4 months, and 6 months. Now, before we ever had vaccines, all of us have a mom who, when we're born, mom gives us some antibodies.
Yeah.
Those kind of last for the first year of life, and gradually over the first several months of life, they fade away. So we start them at 2 months, 4 months, 6 months, well intended, because that's when babies get those diseases. Denmark does it at 3 months, 5 months, and 9 months. Every country, including the U.S., that does them early, they end up with more outbreaks for pertussis, which is whooping cough. But if you wait just a little bit and you align it better with baby's natural immunity, you actually get fewer outbreaks. So it isn't. So you understand the instinct, or we might miss somebody if we don't do this early. But the push to do it early does mean you get more outbreaks.
Interesting. Okay. And it reminds me, throwing in some economics, Milton Friedman, who's my favorite economist, he always said, don't judge a policy by its intentions, but by its results. Exactly. And so what you're telling me is the intentions were good, but the results haven't bared out, right?
They haven't. And, once you get a policy in place, it is very hard for people to want to make any change in that policy. People get very stuck on, doctors don't like to admit they're wrong. So this is just the way we are.
That's true. This is fascinating to me. And I wonder too, like when I had chicken pox, because I'm a kid of the 1980s. I was born in 1981. But I had the chicken pox and it was bad. My sister got it, and I just laid on my grandma's couch for days and, while they doctored them all up and everything and got over it. But I wonder, to your point about herd immunity, how much of that are we missing out on sometimes? Especially I thought about this a lot during COVID. Could it be that we could have herd immunity versus the vaccine and not having the shutdowns and things of that nature? It just seems like, in my view, sometimes these public health officials go a little too far in trying to mandate one-size-fits-all policies versus maybe a more targeted type of approach. Am I off base, though?
You're not, though. And this is where I think you need to actually look at specific diseases. So, varicella is the disease that causes chickenpox. My husband, he went to a chickenpox party, but I had chickenpox, so I'm not sure I would advocate for that. My son got the varicella vaccine for what it's worth, but it is interesting. There is a school of thought that says, varicella, because super contagious disease.
Yeah.
But generally speaking, not a lethal disease. So you have to ask yourself, you don't want to ascribe a human trait, but I'm going to go ahead and ascribe human traits to a few viruses. So varicella is kind of an immune priming disease. Varicella doesn't tend to kill large members of the population, but it does sort of help to prime their immune system. That is one of the theories about why it's so contagious, that it acts as an immune system primer. There are other diseases, for example, measles. Now, measles is a tricky one. If you live through measles when you're a baby, you probably get better lifelong immunity. But if you live through it is a big one. Because what happens with measles is if you get it before you're age 1, then you not only have to deal with the measles itself, but your immune system forgets how to work for the next 2 years.
Wow.
And so
Wow. So you get sick with other things.
Yeah, so a lot of you get 300 or 400 diseases every year pre-vaccine that were from measles itself, but then you got thousands more kids who died because they got a diarrheal illness or they got a flu or something like that. It
Yeah.
basically is called immune amnesia. And you don't get that with the measles vaccine, but you do get it with natural measles. Now, the reality is the measles parties that some people will talk about that happen, those, think about it, were for 5 to 9-year-olds. Those kids, the measles you get when you're 5 or 6 is not the same measles as you get when you're 1. And kind of the reason to me that measles vaccination is so important, and I would put pertussis vaccination in the same category, the babies who get it, they can't get a good immune response. You don't give the measles vaccine until 12 to 15 months. If that baby is depending on herd immunity. And if they get it young, it can be catastrophic, not just in the moment, but for a couple years later. But you're right. And I think your point that we have to look at each different disease individually. And I think of it as, from my mind, the way I sort it out is, how contagious is this disease? Is there really a need for us all to be in it together? To your point, actually, we did end up developing a certain amount of herd immunity with COVID. How lethal is the disease? Because if I have a disease that isn't really going to hurt me as a kid, do I really want to have a kid get a vaccine? Like hepatitis A is not a serious disease in children, but we vaccinate against it. So it's sort of that kind of, is there a community obligation, for a lack of a better word? Is there an individual benefit? And is there really how serious is the disease? Because I do think, a certain number of diseases, a certain number of fevers, a certain number of those things are important for us as we develop our immune systems when we're little.
Yeah, no, I agree, and it's been interesting because over the years we've heard from a lot of folks who are totally against vaccines. I mean, the one that comes to mind is like Jenny McCarthy. She used to talk about this all the time and put a big thing. I think Jim Carrey was on a show with him one time too. Anyway, you have this push against it just across the board, and like I get that to a certain degree, but you've also got to look at what the science says, and you as a medical doctor are looking at what are these different aspects that's going on and looking at public health and all these things together. And each person should be able to have the personal freedom to decide what's going on. But I think what's great about your research, Monique, and everything else that you're doing is that you're really looking at the cost and benefits and the pros and cons of doing these. And I think you're making some really good points about like how early are we getting these? Which ones are we getting? Do you think that the European model is the better model that America, Robert F. Kennedy, the current secretary, should be going towards? Or is there somewhere in between the two?
I think that the European model is a model we can learn from. I would say, and this is a piece, is that when we're looking at the evidence, then to the extent we have to look at what is working and what is not working. And whether or not people think mandates, for example, are a good idea or a bad idea, things are changing now. So to the extent that we have, for example, some states that are saying we're not going to do mandates anymore, we're going to have to offer something else. So to the extent that I would say, let's look at what other countries have done and let's learn from them. So as an example, Japan did an experiment. We can learn the good things, but we can also learn some of the challenges. Many years ago, they decided we're just going to make the mumps vaccine optional. And they were big on having all the separate vaccines, which I think actually does work for some people. There's good evidence from England, for example, that people who are more likely to get a measles vaccine if they can get a single shot. But so Japan for a while said, we're just going to make mumps optional. Well, one of the things that happens at a population level when you make mumps optional and kids don't get it, you get a lot of kids who are deaf. So, and it's not a deafness that you can treat with a cochlear implant, but it was kind of devastating from a public health standpoint. So as we think about this, I would say, look at the timing of the disease, look at what's worked in other countries, and also look at some of the challenges they have had. I think that there is a lot that we can learn. as we look to modernize our schedule. And that is, to me, the bigger part, is that our schedule is so one size fits all now, but we do have different technology. We do have different ways to do outreach, to do this better than I think we used to.
Yeah, no, I agree. And it's interesting too. I mean, some will give Secretary Kennedy some grief or try to, that he's going after this in a way that's trying to move us backwards. But it seems to me, and correct me if I'm wrong, but it seems like he's trying to dig into these a little bit more, gain more information, and spread more education to the public to say, you're a parent, you have personal freedom, you should be able to make your choices. Here's what we're going to go after, and think about and continue to do our research to make sure that we're not setting kids up for failure and everything else. But how do you see how Secretary Kennedy and the Trump administration are working so far?
Consistently, I find what Secretary Kennedy has been saying, what President Trump has said, to actually be very well aligned with the science.
Yeah.
And I think sometimes people will take a snippet here and there out of a press conference. I don't think press conferences are ever the way we should get our medical information. I am continuously impressed by what I see on the CDC website, what I see coming out of FDA. So as an example, when Secretary Kennedy in May said, we're going to make some adjustments to who is going to be eligible for COVID vaccination, that was actually aligning the United States with policy that had changed by the World Health Organization, by Canada, by the UK, a couple of years before. We were behind the rest of the world in doing this in a more targeted way. So when people are saying he's not with the science, I don't know what they're talking about, other than, as I said, doctors don't like to be wrong, and a lot of doctors stake their careers on saying he's anti-science. I really also am very much in favor of some of the revisiting of hepatitis B that's going on.
Yeah, so we have all this talk with COVID and everything else and where things are going. And I wonder, though, too, when you're looking at some of these, like you said, with COVID, and they're trying to change some of these up now, we were behind so many across the globe, what else should we be learning in order to, if there is another, hopefully this won't happen, but another one of these events that happens like COVID and this sort of episode that takes place, how should we be thinking about this different compared to what we went through then?
I think I hope we would learn the lessons that are the right lessons from COVID. I think about the Great Barrington Declaration, and now Dr. Jay Bhattacharya is the head of NIH. But I think of the kind of bravery it took at that time to basically say, if you're healthy and you don't have comorbidities, you should be out and about, and we shouldn't shut down schools, and we shouldn't shut down businesses. And if you are immune compromised, you should stay home. We tried the experiment, which nobody has ever tried in history, of having the people who were healthy stay indoors. That didn't work. It had no historic precedent. We've done the experiment. It failed. So I think even if we wanted to, the reality is we're not going back to that. They're simply, people are not going to accept that as an option. So I think I'm pretty pragmatic about these things. And so from a practical standpoint, I would also actually, a specific thing I would say is with mRNA vaccines, this is another area where we have lagged behind the rest of the world. So mRNA vaccines have a strength in that you can get them up to speed really fast. And that's what Operation Warp Speed was about, like getting vaccines out quickly. But the reality is they are, for lack of a better word, they're kind of dirty vaccines. They're non-specific. They definitely they inflame your immune system. Your immune system definitely gets a kickstart from them. But they are really not particularly specific. That's probably part of why we see things like myocarditis from these vaccines. So the rest of the world, frankly, got their mRNA vaccines up to speed, and then they pivoted to different vaccine technologies. So again, among the things that Secretary Kennedy was criticized for was stopping the funding for new mRNA vaccine research. And he didn't stop mRNA research for other diseases, but the pivot away from mRNA vaccines, that is what the rest of the world has done. And I would say, big picture, if we have another a horrible pandemic in this way, that mRNA, I think, one of the things I hope we learn is that's good for the initial phase, but then you need to pivot to other vaccine technologies.
Well, all those are great points about the Moderna vaccine. I hope we do learn a lot moving forward for the next round. Hopefully nothing like that ever happens again. I hope that we don't see another lockdowns and shutdowns and all of those things. I mean, I think, I don't know where you're at on this, but from a public health angle and looking at, I was looking at a lot of the epidemiologists sort of modeling. And we had the Neil Ferguson saying 2 million deaths. And of course, that scared President Trump and a lot within the political community, along with the public at large. And so I get it that there was a demand to do something. But it really concerned me whenever I was at the White House. I was writing internal memos saying, look, let's not go down this route and all this. But were there any things that you thought we should also learn from as that part on the shutdowns and maybe more targeted sort of resources? One thing I always said, Monique, back then was that I wish we could have done a more targeted sort of resources, especially to the aged, to those who are immunocompromised, things of that nature relative to shutting down all schools and basically keeping people at home where now they're closer to everybody and they can share it easier. But what were some of your thoughts as someone who's kind of studied public health and everything else?
I think, so when I wrote the COVID guidelines, actually, I remember actually going to our board of the organization where I worked at the time. It was June 2020. Yeah. And I said, we can put out guidelines. They were like, no, it's too early. I'm like, no, we know enough. Like, we're good. And these are the guidelines that were used for millions of people beginning that year. By the summer of 2020, we knew that kids were not at risk for school. We really did have a good understanding of this. I would also say that some of the decisions we made about demonizing drugs like ivermectin, I think that was a mistake. Hydroxychloroquine, ivermectin, these were never meant to be drugs for acute treatment. But for people with early diseases, these had decades-long safety profiles. They were cheap. And thinking about this from a public health standpoint and, internationally, these were drugs that were cheap, well-known. We had a wide margin of safety. There were lots of people, millions of people around the world who really buying I'm going to try to avoid saying a brand name, but buying a brand name drug for COVID when there were these old school generic drugs, I think that was a mistake too. And I think, I get that there were things, you can't do a vaccine and speed it up if you have, other treatments that are safe. But I think that there was a lot of demonizing behavior in the name of, in the name of expedience. One thing that really jumped out at me, for example, with Dr. Fauci, was he originally gave percentages of what we would need to vaccinate, what percentage of people for herd immunity. And then some public opinion polls came out and said that a higher percentage of people would be willing to get vaccinated. And suddenly he changed his herd immunity threshold. Like, that is not how science works. And the idea of a noble lie, all it establishes is that you're a liar. So I think that really, I think we have to know. I mean, there was a thing I would say before COVID, but certainly COVID accelerated this, that scientists, public health authorities, they could be gatekeepers of information. When I first was in practice in 2000 and I'm seeing patients, occasionally people would come with a printout from Google, which seems quaint at this point. But now people really do an in-depth research on things. And so I think that is the reality, is that you're not going to be able to do some of the things that we were able to get away with. I just think there's been a democratization of expertise, that people are going to do their own research. And we have to be respectful of it. Frankly, even if we don't respect it, it's happening. So we're going to have to deal with it.
Yeah. One of the things that you emphasize a lot in your work is the humility, right? As a missing ingredient in public health in particular. Why do you think policymakers and experts have struggled with that, especially over the last few years, like we just talked about? And how can involving parents more directly help rebuild trust in vaccines and public health overall?
Yeah, I think the thing about humility is, I don't begrudge some of the mistakes that were made. I do think that people, many of them were doing the best that they could do. I do have an issue with how long people dug in on them and how people
Mm.
are still dug in on this. I think a lot about one of the parents who was one of my peer reviewers. So before this paper ever was finalized, one of the parents who reviewed the paper was a parent who, the day after she had gotten a measles vaccine for her child who had been verbal before that, stopped speaking. Um,
Mm.
you only hear a couple of those stories when you realize if you give a vaccine to 3.5 million kids, even an overall safe vaccine, you're going to hurt some of them. And I feel like
Yeah.
some of that has gotten lost, that we have this binary, it's either safe or unsafe. And no, if you give a vaccine to 3.5 million kids, for example, with the Hep B vaccine, we basically give about 10 million doses a year because we give a few doses to kids. Then the reality is that if there's a 1 in a million chance, then every year there are 10 kids who have that 1 in a million chance. That
Mm.
they're all real kids. And vaccines to me are so different because we're giving them to healthy kids. We're
Hmm.
asking them, if you're going to ask a kid to take that 1 in a million chance, this is not to say that overall vaccines are unsafe. This is to say that even if the risk is 1 in a million, I just
There's
I have a
there's a
hard time.
risk.
I can make that case maybe for some vaccines, but the reality is the way that mandates work, that, since COVID, we've had more than double of the kids who were homeschooled or, in a mandate like
Mm.
situation. So before COVID, it was about 96, 97% of kids who were
Mm.
subject to a mandate. That's now true in Connecticut. And then it falls apart. So
Mm.
look at the rest of the country. You look at Florida right now, Florida, which is talking about getting rid of mandates, they're only at 89% vaccination rates for measles as it is. That is
Mm.
well below herd immunity. And there are a lot of kids who are simply outside of a mandate setting right now.
Mm.
And,
Yeah.
we earned that as a
Yeah.
society. So we're going to have to think, though, if we pull mandates, we're going to have to think we still want kids to get vaccinated. So we're going to have to say, well, a mandate's not going to work. Doubling down on it's not going to work. So let's learn from that and say, are there other things that we can do? Are there other policies we can implement to try to make up for some of that? I think
Mm.
unless we have some humility and acknowledge that some things that used to, for lack of a better word, work, are just
Yeah.
not going to work anymore.
Hmm. Interesting. What have you kept up much with what was going on in Texas? I know, like Fort Worth, Dallas area, there was like a measles outbreak that was going on. And do you have any thoughts on that?
Yeah, I do think, we saw some outbreaks. Unfortunately, there have been a couple of children who died. What I would say is I do worry about this. And I do
Yeah.
think, as we lose some mandates, I think, and I wouldn't be surprised if the Southeast is where we see this because we have a couple of states that are looking to pull mandates, but they're
Hmm.
not actually in the same process of like, what are we going to do instead? So it
Mm.
is just that we're losing the mandate. With that, I worry that we're going to get endemic disease, that it's going to be
Okay.
basically think about sort of measles. It sort of is smoldering in the background and it can flare up when community immunization rates get too low. Right now, I would say there's sort of like little fires that break out. They are not the kind of blazes that we see in California.
Hmm.
But we are setting ourselves up for that if we don't have something to substitute for what the mandates have been. I'm not advocating for the mandates. I'm just saying
Sure.
they're going in some places,
Yeah.
and we just have to come up with a solution.
Because if I'm understanding your research and our conversation today, I mean, it is more about that one size fits all doesn't work.
Right?
It's not optimal.
Yeah.
That really parents, doctors, others, individuals should see what's best for their kids. Is that ultimately where you're at?
It is. And I would
Yeah.
say, when I consider the way I think about vaccines, so I think of measles, mumps, rubella, which is usually a combined shot, diphtheria, tetanus,
Yeah.
pertussis, that those are diseases that I'll go to the mat for. I'll go to the mat for measles. I'll go to the mat for pertussis.
Yeah.
After that, because those are kind of, I would say, if 95% of kids are not vaccinated against measles, it's hard for a baby to be protected. And I want to protect babies, right? So,
Yeah.
I'm a mom. So,
Yeah, sure. Yeah, I'm a
but
dad, so I hear you. I got 3 little ones too.
but I would say in 46 states, we mandate hepatitis B. Now,
Hmm.
I will say that for less than 1% of the population, mostly women who immigrated from countries where hepatitis B is endemic, and to a much lesser extent, women who are IV drug users. So it's, to be precise, 0.9% of the population of pregnant women is at risk.
Wow. Yeah.
99% is not at risk.
Right.
And we have things we could do. If we're worried that the test, we screen women for hepatitis B, I'm sure a bunch of women would be like, yeah, then screen me twice. Do the
Yeah.
blood test for my kid. I'm willing to do my part. But what I would say is, because we've expanded to the 17 vaccine schedule, then everything gets diluted. And when people revisited the schedule and the trust that was lost during COVID, they lost trust in the entire schedule. So I'd really like us to focus on the diseases that are definitely important for community protection, and then revisit as personal decisions. I will say this, from an economic standpoint, there are
Yeah.
vaccines, as an example, hepatitis B. If we gave it targeted, it's a $50 million market. As it is now, it's a $500 million market.
Wow.
So
Wow. Yeah.
I look at a vaccine like rotavirus, for example. It's not really a lethal It's not really a lethal disease so much in the United States. It does save $1 billion a year in terms of avoiding hospital visits and avoiding emergency department visits for kids to get IV fluids. So
Yeah.
as we make our decisions, each different disease outside of some of the core ones, we really, I think, can look at them in an individual way and say, ultimately, it's not that I think that any of these vaccines are inherently bad. I mean, full disclosure, my son got all of his vaccines. He got all of them on time. But that was
Yeah.
my decision as a mom. That was my
Right.
decision as a parent.
Yeah.
And ultimately, when I think about, a parent has to be allowed to make decisions for their kids. And if it's a decision about something that affects other kids, maybe we involve the government in it, maybe.
Yeah.
But if it
Maybe.
doesn't
Yeah.
involve, my kid getting vaccinated against hepatitis B does nothing to protect your kid. That's the reality of it. And so if a parent's going to make that decision, I think a parent, ultimately, nobody's going to look after our kids more than we do.
Yeah. Yeah, amen. I've got, like I said, I've got 3 kids. Full disclosure, 2, they're all vaccinated. They've taken all the ones, and I. But it's interesting that you're bringing up some key points there that are economic terms as well. Like Thomas Sowell always said, there are no solutions, only trade-offs.
Yeah.
And what you're talking about here are trade-offs.
Absolutely.
Every decision that's being made or purposeful behavior that's taking place. And I also big about the non-aggression principle, about not being forced in order to do things, that I believe in personal liberty as much as possible. And so I think that there's some tension that's there, that if we had more information and more knowledge, like you're working on your research and other work, I think is great to head us in that direction. I wonder, though, where do you think we're heading in maybe the next 5 to 10 years? Because it's kind of an exciting time when you think about AI and technology and some other things. It's also concerning for a lot of people, though, too, at the same time. I think the AI revolution is kind of the next big thing for Americans and, well, for the world, really, to be better off. And let people prosper is what I believe God's calling is for my life. And so I try to speak hope and optimism into people as much as I can. And I wonder, from your perspective, where do you think things are heading with it, with so much going on?
I think this is one of the things that makes me most hopeful. I mean,
Okay.
first of all, I do have so much respect for parents, and I do think that they have information. Parents actually are
Yeah.
making informed decisions. As much as a doctor, I understand my life is easier if they just do what I say. It ultimately is better if it is a partnership. So I do think that
Yeah.
parents are feeling appropriately more of a willingness to take a stance to do their own research. I think that's great. I also think, though, that technology right now, I mean, this is part of why I work in AI now. So the company that I work with, we develop AI tools to help provide clinical decision support, to make sure that the labs that are ordered are the right labs. And to be able to do that kind of precision care, so really focusing on the individual patient, the individual family, what their values are, and understanding that we have a way of doing this at scale. That's, to me, I think, one of the things that wasn't so much an option before, is that you really could not scale some of these decisions from a practical standpoint. But now you can. This is not a future state. So as an example, if Florida does go ahead with losing mandates, what if we one of the things that was relaxed during COVID is that you could do text outreach without a consent. So what if we just made it easier to be able to text parents? And if we couldn't align things with the school year and they're not going to do it then, we talk to them like, what's the thing that they value? Is it sports? Is it, is there a camp that they're doing? Align the outreach with ways of getting to parents and thinking then about, I think President Trump the other day talked about individual vaccines. As I mentioned, in England, there's a great study that looked at parents who were hesitant to get the measles vaccine because it was part of this combined shot. But 46% of them who wouldn't get the combined shot, they were willing to get them as single shots. So, why not meet people where they are? I can wag my finger at people all day long and say, but it's just as safe. It's just as safe. You're an idiot. For how well does it work to say you're stupid? I know better for your kid. I mean, they're just going to find it. I've lived in San Francisco. Trust me, there are plenty of doctors who will sign off on whatever waiver you want. But, there are other solutions, whether it's technology, whether it's looking to identify what are the reasons that somebody doesn't want to follow the schedule as it's written. We can do that at scale now. That, to me, is what's so exciting. And we can do it in a way that is more respectful, in a way that better engages people where they are. We're never going to get to 100%, but we can do a lot better.
Yeah. Great points. It's just fascinating work and a great paper that I'm going to make sure to put in the show notes and everything as well. And I wonder, as we're closing here now, Monique, is there anything else that we've missed that you'd like to share or to reiterate for the audience?
Sure. I think vaccines are a really important thing. I think at the population level, they're safe. But I do think all vaccines, just like every medical intervention, has risk. So I would encourage parents to read, to think about the information. I would say CDC remains a reliable source. FDA, in what they ignore the press releases and press conferences. Go to CDC, read what they're writing, read what FDA is saying. They really are reputable sources. I've written a paper on this that I tried to write in a way that was very friendly for people who are not trained in medicine to read. It's at iwf.org. But I do think that really feel empowered to advocate for your kids. Do your own research. And, the reality is it's okay to ask for modifications. It is okay. You might get some people who will have some pushback, but ultimately, you're the person who needs to be in charge. You're the person who's going to live with the good, the bad, all the rest with your child. I think we have to be more respectful of that. But I think if we are, we'll have some pain in the short term. But in the long run, I think we're going to be in a better place.
Amen. I hope so. I hope that's the case. And thank you for all you're doing, Monique, with all this. And I'll be sure to put all this in the show notes page. And thank you for being on the Life Heal Prosper show. And God bless you and your family.
Thank you so much. Blessings to you as well. Take care.
Well, thank you so much. And for the audience, thank you all for joining us today. Hopefully you learned something a little bit more about vaccines and, the decisions that you should be making for your family and what's going on across the country and even the world of how things can compare. I'll be sure to put all this in the show notes page, and you can find more information at vanceginn.com or vanceginn.substack.com, where you can subscribe to my newsletter and find out more information along with this great paper that Monique has written here recently. Until next time, God bless you and let people prosper.